Disease transmission.
In an emergency, some people may hesitate to act because they fear the threat of disease transmission associated with contact of bodily fluids. According to the concept of universal precautions, all blood and certain body fluids should be treated as if they contain potentially infectious bloodborne pathogens. Bloodborne pathogens are bacteria or viruses that exist in blood and other bodily fluids and can cause disease in humans. Following the guidelines of universal precautions can help reduce the risk of disease transmission. This includes becoming educated on bloodborne pathogens, washing your hands, wearing protective clothing, having and using protective equipment such as gloves and masks, and having a first aid kit that is readily accessible and fully stocked. Always have a first aid kit in your home, car, and workplace. Keep it fully stocked and stored in a dry place. Remember to replace used and outdated contents regularly. A first aid kit should contain a chemical cold pack, scissors, adhesive tape, disposable gloves, antiseptic wipes, triangular bandages, roller bandages, sterile gauze pads, adhesive bandages, and tweezers. You should also have first aid guides for reference. And remember, a properly stocked first aid kit should include a breathing barrier in case resuscitation is needed. Special considerations for disease transmission. Washing the hands properly can help prevent the transmission of germs. First, wet the hands with warm, running water. Lather with a small amount of mild soap. Scrub vigorously and thoroughly. And rinse. Leave the water running while you dry your hands with a clean, disposable towel. Finally, turn the faucet off using the towel as a barrier between your hands and the faucet handle. To correctly remove gloves, peel the first glove off from the wrist, turning it inside out. To remove the second glove, grab it from the inside at the wrist and roll it off, making sure you do not come into contact with the outer surface. Use a biohazard bag to dispose of any contaminated materials.
While each of these viruses causes similar effects on the body, they are two different viruses. Hepatitis viruses affect the body's immune system differently than HIV, but they all cause serious illnesses. Hepatitis means inflammation of the liver. The liver is an extremely important organ in the human body. It has many essential functions, including helping make medicines and nutrients usable for the body by metabolizing them. It also filters toxins from the blood, assists with immune function, and produces substances that are used by every cell in the body. If the liver is inflamed, it is unable to function properly and causes the infected person to feel very ill. If the inflammation or liver disease continues over time, the infected person may become very sick with cirrhosis of the liver or liver cancer and can die without intensive medical treatment.
Infected blood can enter the skin of an uninfected person when helping someone who is bleeding. Hepatitis B and C can be passed from a mother to her baby while the mother is pregnant. Hepatitis B can also be transmitted through sexual intercourse with an infected person.
Unlike HIV, which cannot stay infective when outside the human body, hepatitis B contaminated blood can remain infectious for at least 7 days outside the body, and hepatitis C contaminated blood remains infectious for up to 4 days. That is why frequent hand washing is one way to prevent the spread of these two viruses. Hepatitis B is preventable by a series of 3 immunizations or shots that the doctor can give. Many children are required to have these shots before kindergarten. Older teens and adults may also get the hepatitis B shots if they did not have them as children.
HIV doesn't attack the liver or the heart or the respiratory system. HIV attacks the immune system itself by infecting white blood cells called T cells. When HIV invades T cells, it reproduces and weakens these cells, often destroying them. This doesn't happen quickly, and someone can be infected with HIV for years and not feel sick. But after a while, often more than 10 years after being infected, so many T cells are destroyed that the immune system is seriously weakened.
Fortunately, HIV cannot be passed from one person to the next by casual contact. It is not like a flu virus, for example. You cannot get HIV from being in the same class as someone who has it. You cannot get it by drinking from the same glass. You cannot get it from touching or hugging or even kissing a person with AIDS or who is infected with HIV. There are only 3 ways that you can get the HIV virus, as Dr. Marjorie Seratoff explains.
HIV can be transmitted in 3 different ways: through sharing needles or works, where people use intravenous methods of injecting drugs, through intimate sexual contact where bodily fluids are exchanged, or through blood. Blood transfusions at this point in time are safe, although in the past there were some difficulties with them.